Anything been done in terms of draft from the bill or from the corporate houses where a proper monitoring system for NGO and for the corporate houses is maintained? Because there's always been a big gap, as been rightly pointed out, in terms of what is expected out of you. Bottom line for each one is different. Is there some kind of a draft being taken care of, or is there something which can be done now, which should be done, I think so, whereby some pointers are given out to, for example, an NGOs as well as to corporates, because when they want to partner, they should have that guidelines with them.
Sure.
I think that's very important. Right now. That's a question.
Two more.
Sorry, sorry, sir. I shall restrict the questions right now because we have some, the kitchen guys have come to us and, you know. Yeah, please ask. No, we might have the same answer.
Till for the public to respond. Once they get response, then they put it in a form. That's what they call notification. Then comes the question of compliance. So I think you have to wait for that, what really happens. Would you like to answer?
I'll take on Akash's question. Akash mentioned about community participation. Now, the question wasn't very clear, but I think it's very critical that we ask what the community needs and not what we think the community needs. That's why I think it's right that we, after carrying out a baseline survey, engage with the community on the needs that they have, and that will make a difference and a better impact. Akash, I think that was, where's Akash? Yeah. And yes.
It's well taken.
No, it's definitely well taken, and also would like to say that the academia has a very important role over here with all our CSR initiatives, and we keep going and speaking to various institutions, getting them engaged in CSR or getting them a kind of a knowledge and creating an awareness in CSR work with the corporations. So whether they join this MSW or they are marketing guys or they are from some other finance background, if they have that background of CSR, of corporate engagement with communities, they are better people and they are better, I think, employees in the companies.
I just wanted to answer quickly the question on the doctors' associations, which is good. Any of the social franchising programs are exactly working through your associations, whether it's IMA or FOXC or any of these, and they're extremely important partners, so absolutely point taken. And then the very good question also about monitoring systems. You know, at one level, if we make it too high level, everything will just look alike, and it won't be very good. But I definitely take your point that what's required is both from the corporate side and the NGO side to have a very clear framework of results. And a lot of us might need some training in, you know, how to actually build a program that will have some impact. It's very easy. You know, we all work with different results. My very favorite is the logical framework that Rahul talked about. And if NGOs use these and the corporates accept them, they can build them together, and then the individual projects at least will have more impact. So.
Yeah, I'll just add to these thoughts. One is that in terms of the partnerships, we are seeing partnerships which involve communities. For example, in case of the self-help groups, there is SERP, your organization, there is RG MVP, which involves the communities. And in our work, it is not only the academia through organizations such as PHFI, INCLIN, etc., but also the doctor association, for example, IAP, which gets involved in protocols related to child care. So they are getting involved. And the idea is that whatever partnership businesses think of, if it can involve as many functions, as many sectors as possible, the chances of success would increase, provided you are able to manage the stakeholder. That was one. Second, in terms of monitoring, I think the simple thing to start off with is that if this were a business idea, what are the parameters that you would want to track? For example, in childcare, there is an RMNCH plus A scorecard that the government has rolled out, which measures the outcome in case of childcare as well as the inputs that should go in to achieve that outcome. Take that as an example, and you could form your own scorecard which you want to which you want to use as a monitoring tool. My sense is, and I think this is still open for debate, but my sense is that if you are satisfied with the outcome that you have been able to produce for the society as well as the inputs that are going in there, the government also would be satisfied. Similar to the fact that once you are generating a profit, your shareholders don't question you as long as you are generating profit. Similarly, in this case, if there is a social impact that you are able to demonstrate through your scoring mechanism, people would be satisfied. That's my sense.
I'll comment on 2-3 things, just to pick up from where Rahul is left. Monitoring and evaluation still remains a very gray area. And while I was on the side of the corporate, this was still very humbling to know that sometimes when we consulted some of the top consultants to do some kind of monitoring and evaluation, the cost of such exercise was sometimes more than the cost of the project. So I don't know what monitoring evaluation we were wanting to do. There's no standardization around this. Some people want to look at the inputs, others are talking about outputs, some others are talking about outcomes. Outcomes typically don't come in a short span of 6 months or 12 months time. So, but most of the corporate funding or other donor funding is KRA driven. They want to see the results. They want to see a brick and mortar kind of real impact being made. It is probably in their terms, the real impact could be how many health camps conducted, how many people touched, etc. Not really knowing whether what were the real outcomes. So what is the change, behavior change, etc. People don't have that patience. Simply to say this, so this is a gray area. We need to all work together and break our heads together for this. Community participation, I don't think when we were talking about partnership, we were ever talking about anything, doing anything aside community. Community is the centerpiece. Our development model is basically inside out. It starts with the community. It is not for community, it is with the communities. And in the change paradigm, we spoke about creating shared value. In that same breath, we look at these communities not as recipient of services, but more as consumers, producers, people who could